Is it the right time to have a total knee replacement surgery? Hi guys, my name's Tony Maritato. I'm a licensed physical therapist, and in this video series, I'm going to be answering the 12 most common questions related to total knee replacement surgery. Question number one is it the right time to have a total knee replacement surgery? There are several factors that must be considered when you're choosing the right time. First, you need to ensure that you're having it for the right reason. And that's a conversation that has to happen with the orthopedic surgeon who's going to be performing the surgery. Often the surgeon will try alternative measures before going to knee replacement. They might try over-the-counter medication, prescription medication, and injections. But at the end of the day, if the surgeon believes the best option for you is to replace the joint, then that will be the recommendation. And then you'll have to decide when it's the best time. You need to look at, do you have support in the home? Nobody can tell you what the recovery process will be like for you personally, so you have to plan for the worst. You have to look at, what if I cannot go home? What if I can't go home and be independent or safe by myself? Do I have friends or family around who can help me? Is there somebody around that can drive me to my physical therapy sessions if I can't drive myself? Am I able to feed myself, bathe myself, dress myself, all of the basic activities of daily living, and can you do it safely? And do you have support? Because this is an emotionally draining procedure. Patients often experience episodes of sleepless nights, fear, frustration, anxiety. Certainly there's pain. And so you want to be sure that there's a support system around you that can help you through those challenging times. So those are some of the factors for you to consider when you decide, is it the right time for you to have a total knee replacement?